Hi everyone, this is Dr. Pasunuti Sumanth, children's specialist. As breastfeeding is a natural thing to do, but it still comes with its fair share of questions. Here's what you need to know about how often and how long to breastfeed your baby. Here is the first question, which is very common to all the mothers. How often should I breastfeed? Newborn babies should breastfeed 8 to 12 times per day for about the first month. Breast milk is easily digested, so newborns are hungry often. Frequent feedings help stimulate your milk production during the first few weeks. By the time your baby is 1 to 2 months old, they will probably nurse around 7 to 9 times a day. In the first few weeks of life, breastfeeding should be on demand whenever your baby is hungry, which is about every 1.5 hours to 3 hours. As newborns get older, they will nurse less often and may have a more predictable schedule. Some might feed every 90 minutes, whereas others might go 2 to 3 hours between feedings. Especially, newborns should not go more than about 4 hours without feeding, even overnight. Now, the most important one, how do I count the time between feedings? Count the length of the time between feedings from the time your baby begins to nurse to when your little one starts nursing again. In other words, when your doctor asks how often you are feeding, you can say about every 2 hours. If your first feeding started at 6 a.m., the next feeding was around 8 a.m., 10 a.m., and goes on. Especially at first few weeks, you might feel like you are nursing around the clock, which is normal, and soon enough, your baby will go longer between feedings. This is another important question asked by almost all mothers, that how much time they should feed each single time. Newborns may nurse for up to 20 minutes or longer on one or both breasts. As babies get older and more skilled at breastfeeding, they may take about 5 to 10 minutes on each side. How long it takes to breastfeed depends on you, your baby, and other things such as whether. The first reason is your milk supply has come in, which is usually happens around 2 to 5 days after birth. And the next one is your letdown reflex, which happens right away or after a few minutes into your feeding. It depends on whether your milk flow is slow or fast, or your baby has a good latch, taking in as much as possible of your areola. Or it depends on your baby begins gulping right away, or it takes it slow, or if your baby is sleepy or distracted. So, all these factors play a role in deciding how long your breastfeed will take. If you are worried that your baby's feeding seems too short or too long, consult your pediatrician. Alternate the breasts and try to give each one the same amount of nursing time throughout the day. This helps to keep up your milk supply in both breasts and prevents the painful engorgement. Your baby may like switching breasts at each feeding or prefer to nurse just on one side. If so, then offer the other breast at the next feeding. Do whatever works best and is most comfortable for you and your baby.